right, I think we're just about ready to go. And so I'd like to thank NSF today for assisting us with this webinar, for sponsoring it, and for making sure that you can get the best information possible to help you to ensure that your COVID-19 plan will stand up to scrutiny and that you have confidence in that regard. I have three very special speakers, which I would like to introduce to you today. And so we're going to go through some short introductions so that you know who's going to be presenting to you. And you'll be chatting to them a little bit later as we go through the Q&A session. Our first speaker today is Wouter Conradi, and as you can see, Wouter is the Managing Director of the operations, the Africa operations for NSF. Obviously, NSF is a global organization, and he heads up the Africa branch. His background is food science, agronomy, and retail. He's got a great team. There's more than 90 of them, and they've got their fingers in lots of pies, including agriculture, food, retail. They are involved in developing standards, they conduct audits, they have certification services, and they provide training to their clients as well as testing services, not only in South Africa, but within 15 African countries. Wouter loves his job and he enjoys managing and motivating this great team of people, because at the end of the day, they are the reason for the success of NSF in Africa, and they're there to assist you and to innovate in order to serve you better as their customer base. Wouter will be joined by two of his colleagues. Jason is picking up our second slot this morning, and Jason has 20 years of experience in the food industry, and currently he is the Food Safety Manager for NSF Africa. He is consulted, he's audited, he's trained, and so he has extensive experience in developing, implementing, maintaining, and auditing food safety management systems, right from the very basics in terms of a GFSI system all the way through to the most sophisticated benchmark food safety management systems. He's been involved in a number of different disciplines within the food industry, as well as beverage, packaging, and feed. He's trained more than 5,000 delegates in food quality and safety. He's a senior lead auditor and trainer, and he is really there to manage the supply chain food safety division within NSF. So he's got a wealth of experience, and he's going to be using that to assist us with your COVID plans. And then last but not least, bringing in the home stretch is Anja van Wyk, and she has a commercial qualification. She's the business-minded one. She manages the financial disciplines within the organization and in-office operational aspects. She's been with NSF for 15 years. She's currently specializing in the food service division, and there she's bringing all of her efficiencies, or rather her insights in efficiency and data management, to make sure that her clients within this fast-growing retail service division have got all the right information to manage their food safety management systems at their fingertips. So I'm really, really honored to be able to chat to these three people today. And so without further ado, I'm going to ask Wouter to take us through the agenda for today. Obviously, we have a lot. Thanks, Wouter. Over to you.
Thank you, Linda. Okay, I will first tell you what we're going to share with you today. I will first go a bit into human psychology and behavior to see what makes us comfortable to return to a place of perceived risk. Then my colleagues, Jason and Anja, will tell you how our three-phased approach helps reduce operational risk and how you can communicate your commitment to best practice to your employees and customers. And lastly, we will tell you a little bit about NSF, who we are, and why you may want to work with us. We will then switch back to Linda for questions and a discussion, so feel free to send your questions to us during the presentation. So many parts of the world are reopening after COVID-19. Local circumstances may vary, but we all share the same core concern. How do we operate our business while reducing infection risk for staff, clients, and customers. To feel comfortable engaging in activities outside the home, most customers are waiting for reassurance beyond the lifting of governmental restrictions, such as the implementation of visible safety measures from stores, restaurants, and other indoor establishments. How can you earn trust and get your customers to return? The Boston Consulting Group published some very interesting statistics on human behavior following a crisis. According to their study, 80% of people are willing to return to their normal activities after a situation that caused them fear, only if they know that safety measures are in place. If you look at the graph, on the right side of the line, you will see how many respondents per 100 said that they are likely to resume their normal daily activities. 68% want to see that social distancing is enforced. 64% want hand sanitizers to be provided. 57% need to know that regular antibacterial cleaning is practiced. 36% want to see that people are wearing their protective gear. Some even want to know that you do regular temperature checks and that you make sure that the air quality is managed properly before they are willing to return to your shop, office, or school. The bar on the right sums it all up, that 80% are willing to return if they can witness at least some measure that are in place. There will always be a few, but only 10% that are not really concerned. Well, there are those 10% that will not even return after all the controls are in place. And we know that these may be people who are themselves at higher risk. Why is check by NSF so important? Well, for customers or consumers to feel comfortable going back into a store, a hotel, a dentist practice, you name it, they are all going to have to see visible activities of COVID-19 controls. If they do, they will feel more comfortable and they will be more likely to go back. A lot of these controls are quite visible. I mean, you can tell as a consumer, you can tell if people are social distancing, but what you can't necessarily tell are if the people behind the scenes or the processes behind the scenes are going on. So you might not have that form of assurance, but knowing that a company has had their program vetted by another trusted organization, like an independent organization such as NSF, really means a lot. In a study that was published recently by the University of Michigan, they used an index and have shown that consumer sentiment rose in May to 72.3 from an April level of 71.8. This is significantly lower than what it was in February. Another study on employees have shown that as many as 78% of our employees expect their employers to take actions to protect them as well as their local communities. And then, of course, we are all aware of the devastating impact of COVID-19 on job losses here in South Africa. Most industries and sectors are seriously hit with consequences of the outbreak, and we have witnessed a great deal of job losses, including banking, agriculture, manufacturing, and community services. According to the National Treasury, a total of 1.8 million jobs could be lost as a result of the current pandemic here in South Africa, while unemployment might surge to as high as 50% in the worst case scenario. So, if we cannot create enough confidence in people to want to return to your business, there is a lot at stake. So what have we heard from our clients? And here's a few things that we heard they say, and I'm sure you will find and resonate to a lot of these. I'm swimming in guidance. What I need is help operationalizing it. You go online and you get so much information on how to reopen through COVID-19. But a lot of this information you get, I call platitudes. A platitude doesn't help. You need to convert a platitude into a program. Just saying, hey, maintain a 2-meter distance isn't enough. You need to operationalize that. And that is what organizations are really struggling with. How do I make sure? How do I know that my program and what I put in place will ensure that social distancing is being maintained? They're also concerned that their customers or visitors wouldn't take too well with all the new protocols. They are concerned that their customers could be too worried to return, or that the employees would be too worried to return, or the families of the employees wouldn't let the employees return. So communication becomes critical as not just to your employees, but everybody that supports your employees coming to work. And of course, it will cost time and money to meet the requirement. And companies are spending a lot of time and money, all while they are earning a lot less money. So what is the solution? We are really pleased to share today our solution with you. A solution that has already been taken up by many organizations in other parts of the world, from hotel groups, very large quick service restaurant groups, retailers, cultural organizations, schools, university, and to name but a few. Some are big organizations, but there are also, for instance, small family-owned businesses with 3 or 4 restaurants that needed our help. So, meet the requirements of the new normal. We need to refocus our attention to give people confidence to return to work or to our enterprises. Employees and their families need to know that you are serious about their safety and health. Customers need visible evidence checked by an independent party to see that you are serious about their safety and health. And the business community, who supply or interact with your organization, need to see that you are serious about their safety and health. So how do we do that? What is checked by NSF? It's a public health service offering that helps mitigate the spread of COVID-19. The program is the embodiment of our mission and values. But more importantly, this is giving you an opportunity to protect others during the crisis or any other crisis that might come in future. Check by NSF is designed to apply to your business at any stage of your journey in creating and deploying activities to reduce the spread of the virus in your facilities. That includes those of you that are about to reopen, those that you have already opened, and those that have never closed in the first place. I also would like to emphasize that this is a global program delivered from the more than 180 countries where we work. The Check by NSF program is a unique combination of consulting and assessment that combines a technical element with the use of a really smart mobile app that Anya will tell you about. This is a flexible program that was put together by a team of very experienced people from our food safety and health sciences divisions across the globe. The key word here is flexible. Our approach will be different for each client. Some may only need our help in phase 1, or they may only need a combination of phase 1 and 2, or only phase 2, and others might already have a very robust and entrenched plan in place and would only want to use the mobile app to help their managers to monitor and control their activities. So, Check by NSF recognizes that any company or organization goes through 3 phases of reopening. The initial phase is, of course, to plan. You need to get your ducks in a row, establish and develop your programs, and you need to form and train your team. Once you have developed your plan, you need to develop your next phase, and that is the implementation of those plans and protocols. You have to implement that by training your people, preparing your site, putting the engineering controls and flows in, and all of those details. Then the third phase, and this is where I get concerned, is where we are, and we are seeing it right now all over the world in outbreaks and in other places and here in South Africa. My concern is that people forget about phase 3. Companies will reopen, pat themselves on the back, and they will say, okay, we're doing well. And even if they're not doing a great job, if community spread has dropped in the region, chances are that they are going to get away with it. But as one of the well-known doctors here told us last week, he said it's only when community spread increases again that we'll know if our individual programs are working. In other words, you might get away with it now, but at some point, when a second wave hits, or when any other crisis happens, and you are not prepared, you are going to get hurt. And we take this to heart. And one thing that I am most proud of about this program is around phase 3. That is where we help you to ensure that you aren't just putting a sticker on your door, but you are actually having a living, breathing program that you continue to monitor and improve all the time. We can support you in all 3 phases, through assessment, through training, and Anya will discuss later through a very useful mobile app. So you can have it all, or based on your situation, you may only need parts of our support. But let me hand over to Jason and Anya, who will give you a lot more detail on how this will work.
Good morning, everyone. My name is Jason Nyman. I am the Food Manufacturing Service Manager here at NSF International Africa Operations. And what we do, we help companies, or we help individuals, companies, understand food safety and quality management systems, and then check that they have effectively implemented these systems. So today I'm going to talk to you about the 3-phase approach for obtaining checked by NSF. Now, we all need to prepare for the new normal, especially where there are large numbers of people that congregate. Now, restaurants would be the initial and obvious concern for us as people from the food industry, but we also need to consider other areas and industries where people could congregate. Okay? It's not just the food industry, but it's all sectors. If you think about recently, about cinemas, churches, schools, call centers, malls have all reopened, and these places should be considered because they are areas where people do congregate in this as well. Then there's also the risk that COVID may be around for another year or 2. We also need to consider the fact that businesses are opening and society is reopening, so we need to look at that as well. We need to consider how we are going to manage these risks so that we can make sure the businesses stay open. We need to look at our vulnerable employees and how we can protect them. And also we need to develop procedures in the event that we have an infection at our facilities, how we're going to do screening, how we're going to test, and how we're going to decontaminate. There are further risks to consider. Regulatory guidance needs to be followed, communication to staff, revenue. So do we have enough to cover the immediate costs or bring back customers and staff as soon as possible? Okay? And almost every sector is currently in business recovery. We therefore need to build and put systems in place which are resilient. Okay? We need to consider customer and staff health, communicating your reopening plan as quickly as possible to stakeholders, the speed of revenue back into your business, and then obviously avoiding a subsequent closure following the large investment required to reopen your facilities. Now, the program has got 3 phases. It is flexible and robust and can be applied at any phase of your journey, whether you're reopening after COVID or just improving on your systems that you already have in place. The program is available for everyone, and like I said, it's not only focused on the food industry. Now, the 3-phase program covers the following. Phase 1, pre-open. Okay, so completion of phase 1 means that the location has completed development of the required safety procedures, policies and plans, and this can be done either by the facility themselves or with the help of NSF. Phase 2, which is the reopening phase. Okay? Completion of this phase means the location has successfully implemented the required safety policies, procedures, and plans. Phase 3, the stay open phase. So completion of phase 3 means the location is successfully maintaining and improving the required safety policies and procedures. Now, the third phase is usually forgotten, but it is an extremely important one. This is the phase that helps you stay open by continuously checking your system that you guys have implemented at your different facilities. In some instances, sites will open well and the company will believe that everything is okay until there is a reinfection or spread and your system gets tested, and then you realize that you're not as well off or not as prepared as you originally thought you were. And I'll talk about phase 1. Okay, so phase 1 is all about planning and developing the program. Your customized consulting programs and gap analysis that can be used to assist sites. Where sites have already implemented systems and have already reopened, NSF can check and validate, and if necessary, amend the system to ensure that sites have the ability to stay open. If the client has nothing in place, we can also help them from scratch and develop the systems or the programs with them. We have templates, we have consultants and training materials to cover all relevant industries, and we also have consulting tools and approaches to help companies develop or improve the reopening plans and protocols. The first phase deals with the the formation and training of your COVID team. Okay. We will develop a high-touch and physical distancing analysis with control plans in place. We can also assist you with the development for protocols for things like water, ventilation, staff illness, and other issues that may be of specific concern. And all of these can be substantiated through the mobile app that we have created as well. So looking at the picture displayed here, some consultants can make things look easy, and some clients really do have systems that aren't that complicated to develop and implement these type of programs. However, some systems are very complicated, and if we think giving these clients a checklist to assist with or plan the development, that is a mistake. Remember, I mentioned this is not just for the food industry. It can be used in any other industries where there's numerous amounts. Think of call centers and places like that where there's a lot of foot traffic. So this is not just the formula where you plug in information and out comes your system. Okay? This is a deep dive to understand the flow of the business and how the implemented system will affect things like ventilation, or understanding how putting up shields will affect your ventilation in your facility. Okay? The example above took countless hours, and this is looking at a 74,000 square meter facility. Okay? Time spent figuring out people flow, capacity, and distancing. And for other sites, like I said, the system can be easy, but in this situation, it took quite a lot of time using quite a lot of experts to help this facility develop their system. Okay. In this instance, the client was happy, however, with the system that was developed and eventually referred us to another client, so we were quite happy about that. With phase 2, once we have assessed the plan and helped develop the plan, then we need to make sure that the site is effectively implementing the plan, and that's where the phase 2 comes in, the implementation phase. Okay, we will then check that the plan has been implemented as it was written, and this is where it can get tricky. The key to assessments is to understand the system and COVID itself. So we need people that understand systems, understands all of that, along with understanding the risk that COVID presents. So if the client does end up tweaking the plan, we can still check to ensure that the outcome is not negatively impacted and we will still get the same outcome that we originally planned for in phase 1. There are numerous consulting tools and approaches to support and validate that companies and organizations have implemented their reopening plans and protocols that we can use. These include training of your frontline staff on protocols and ensuring that all facilities meet the local requirements for COVID. Okay. Checking if we have implemented the protocols and at the different locations, or if they have a representative sample of sites. So basically what this means is a facility has the option to either do all of their, or a company, should I say, has the option to do all of their sites, or take a representative sample and start the implementation, or base the implementation based on that. Okay. The sampling approach can be used for businesses that already have established quality management systems in place. Think of international fast food chains and the like. They will already have checks and balances in place. They will have audits conducted at the individual facilities. So taking a sample initially and then using that at the other locations would be feasible because they have got a manageable QMS system in place. But the sampling approach may not work for everyone, especially smaller organizations or companies that do not have a proper QMS system in place. In that instance, we would recommend that all the facilities be looked at. Phase 3. With phase 3, we're now looking at the staying open and the continuous improvement parts of the Check by NSF program. Okay. The science of COVID-19 is evolving, and companies who wish to increase the likelihood of staying open need to continuously improve and upgrade their programs, protocols, and approaches to ensure they can adapt to these changes. NSF has a history of providing audits, so we've been in the game for quite some time, and the continuous program, or the continuous improvement program, is very much like what we do, or what we have done in the past in the food industry. Okay. This can include creating a service or process for companies to self-monitor the program on an ongoing basis and provide external validation that their steps is being followed. In other words, we can basically either train up individuals within the organization to do the checks for them at the different sites, if they have such a system in place or such a program or structure in place, or we can do it for you ourselves. If we are doing it yourself, then we also will be validating it externally. An example I can use here is think of the schools at the moment. With the confusion around schools, a system like this would actually come in quite handy. So what we could do is we could go in, assist them in developing proper procedures, help them implement their procedures at the different schools, and then train up school inspectors to be doing the actual checking audits or inspections and assisting or monitoring those schools. So it doesn't have to be something that we physically have to do. It could be something that we could train up individuals like school inspectors in this example and get them to go and have a look at it. And same thing goes for any other organization. If you have got a system where you do have people doing checks on your facilities, it could be that we could train up these individuals to do these checks and assist. And obviously, we can do that using the different operational assessment tools we have available. So NSF can train their staff at facilities who have continuous monitoring systems in place to conduct the assessments, like I said. And the objective is to continue to monitor, manage, and improve the systems and practices implemented by the site. Now, these can be conducted through on-site visits, remote assessments using ICT, desk assessments by our experienced consultants that we use, or through the use of our app, which Anya will explain to you in a short while. You can also use a combination of the NSF app functionality as well as monitoring through remote or in-person audits. So there's nothing wrong with using the combination tool as well. Sites already with NSF and that's being audited by us already for whatever system, can also choose to have this as a bolt-on. So the auditor or inspectors or retail inspectors we have now can come to a facility, and as part of the inspection or audit, we can bolt on 1 hour pretty much for sites to do or for our people to have a look at the COVID controls in place that has been set in place checked by NSF, and we can include that instead of coming out and doing individual checks. So what do you receive when you opt for this program? So we spoke about the phase 1, which is the planning phase, phase 2, which is basically the implementation phase and how it can be assisted, phase 3 being the continuous monitoring phase. So what do you actually get? At phase 1, you get a customized consulting program or gap assessment, optional training for your staff, training of your COVID team on the COVID basics and how to develop a COVID control program, training for your frontline staff on the COVID basics and client-specific requirements, pre-approved press release announcing your partnership with NSF, and a large format branded poster which you can put up in your business. At stage 2, you get the checked by NSF window statement for you to display. Note that the sticker or statement will have an expiration date, and this is so that the customer can be assured that the process is continuously monitored and ongoing. So it's not just a sticker that you can put against your door, leave there for a year or two and say, yes, no, we are still being checked. You need to be constantly monitored, whether it's through yourself, doing internal monitoring or people that you've trained up, or using NSF to do it for you, or using the app. We need to make sure that you are being monitored constantly, and for that reason, the sticker will have an expiry date. Okay. The use of branded posters in the front and the back of the house, and as an option, we can do a co-branded opening day press release as well. At phase 3, you receive a customized operational checklist via your app, continued use of the check by NSF window statement for the client to display, and the NSF oversight through the app. So we can monitor you, and we will monitor the system through the NSF app. Just to point out that the NSF stickers that you get, or the statements that you get, will only be available or only be issued to sites at the implementation phase, which is at phase 2. You won't be getting a sticker yet at phase 1. So another nice thing about it is you have an option to use 2 different types of stickers, and this one you have here is what they call the phased approach. So you will see the phase 1, day completed, phase 2, day completed, phase 3, day completed, and when it expires. And on the next slide, I will show you the other one, which is, I know that one is more popular in the UK, according to our clients or our colleagues on that end. Although I must admit, I like this one a bit better. So with this, the program takes around about 12 weeks and up to complete. And that's from stage 1 through to stage 3. But there is other approaches. Okay? And as we have previously mentioned, the program is very flexible, and there are other approaches that you can consider, which includes blending or only opting in for certain steps. Now that's the nice thing about this system. You don't need to go for phase 1, 2, or 3. You can opt to go for either just one phase. You can opt to go for a combination of phases. There's a restaurant group in the UK that asked us to assist them with the system, but they only opted for phase 1 and phase 2. So basically, they wanted us to help them plan and develop their system, and they wanted us to help them implement the system. And they are monitoring it themselves. So they didn't want the app, and they didn't want us to come into audits. They just wanted us to assist them with the implementation and planning. Nothing wrong with that. But also remember, we are very understanding, and we do understand at the moment that there is, especially if you look at restaurants, there is a big issue with revenue and finance and cash flows. So to make it affordable and to make it open to everyone, we are making it as flexible as possible. The other option, and especially nice for smaller facilities, is just using the app, the phase 3 approach. So you develop your own system, you implement it, and then you use the app, or you can use our remote or audits for you to check your system and to make sure that you are continuously improving. So, in conclusion, or lastly, COVID is not like food safety. Okay? We have to ask ourselves, will the system we develop today be sufficient, and will visiting a site every 6 months or so be as prudent as in food safety? Okay? Will these be valid in a post or current post-COVID world? Will operating procedures developed today be valid if a new wave of infection hits us? And as I'm sure you know by now, the information we have about this pandemic changes regularly, almost daily, and the systems created needs to be able to change as the information changes. COVID may be new, but infection control and good hygiene requirements are not. NSF has been doing this sort of public health and safety work for over 75 years. We support all 3 phases through assessments, through training, and as Anya will explain next, through the app. And the nice part about it is you can opt in for all of it, or based on your needs and finances, you could choose for any one of the phases. It's completely up to you. If you require any more information, you are more than welcome to contact us. I will now hand you over to Anya to explain the app. Thank you very much for your time.
Thank you, Jason. Without question, we need to ask ourselves, are these systems and processes still going to be valid in, say, the next wave of infections or in another crisis or pandemic? I have the privilege to tell you how you can complement the processes and phases of your safety protocols to address this ever-changing standards to operate a business under COVID-19. We are proud to introduce the Check by NSF app. The app allows NSF clients to quickly adapt their daily operations to new regulations and procedures, which is available on the app. It is a tool that you can use to create self-assessments. You can gain oversight of your risks and have visibility of your workflows and include notifications and reminders. During phase 1, as explained by Jason earlier, the app will be set up to include adding your protocols and policies. That will also include setup planners and timelines to include training and scheduled self-assessments. During phase 2, the implementation will start. During this phase, the presentation starts on the site and administrating the controls with the app, Check by NSF app. And during this phase, you will actually use the application as a checklist. You will use it as your daily task list to help you during the phase 2. During phase 3, your business is open. Now it is important to maintain the protocols, and that's where the app will be your personal assistant. The app has been designed to easily identify improvements within your controls and to implement them almost immediately to reduce the risk. Within the palm of your hand, you will have the access to your data. The key to manage the process within your business is to be proactive and to flag where you have suspicious behavior. That is the most important part. The app will serve as a personal assistant that improves engagement between your area managers and stores by action plan resolutions, scheduled internal assessments, and even surprise inspections. And the app will do that by alert proactively by means of flagging late or incomplete or suspicious checklists. Right, so now you have trained your staff, your controls are in place, and your staff is doing what they are supposed to do, so you think. But the risk doesn't go away. You have data, but what is next? Based on our software development system called Traction, a comprehensive data management tool is built into the app. This enables a clear view of your compliance to the protocols that you've set up and proactively point out possible risks with the help of predictive analytics. The app and program is more than a checklist exercise, and that's very important. It serves a purpose. Everyone has a mobile phone. Therefore, should a change come into effect, as it does these days, your staff and team will know immediately and can action accordingly. What makes this program so unique is that it is available for all types of industries, even a museum. It can be used in a small shop or a large institution with multiple facilities in various locations. Let us help you save lives and ensure a better, healthier future. Thank you.
Thanks, Anya. I would really like to understand a little bit more about how NSF has actually used this around the world and how we can benefit from that experience, because obviously we are a little behind the curve in some cases. And so with regards to the experience of NSF, I think it will be useful to understand that just a little bit more in relation to practical aspects that have actually been applied. Obviously, from NSF's perspective, I think it is important to appreciate the fact that NSF is not an organization that started yesterday. It's a well entrenched organization. It's been around for many years. You know, you're gleaning here from the extensive experience that you know, you have in many different countries, as well as the many different aspects of assurance that you're involved with. So I think these couple of slides do provide a baseline for why NSF would want to be involved with this process, and the reason why the market should take note of the service. Obviously, you are an independent organization, and I think that's important because in this process, to give people confidence, I suppose if you're marking your own exam paper, it does put a question mark over the processes. And although the law doesn't necessarily require an independent assessment of your systems, I can fully appreciate why this kind of process would definitely assist a large organization with a very you know, significant brand, like, for example, you know, a national hotel group, why it could definitely benefit them. So I think it's important that, you know, we do place the context in relation to the role that NSF has played worldwide, as well as, you know, within our country, and we definitely acknowledge that. I'd like to now open the floor to some questions, and in order to do that, I'm going to also ask the presenters to come online because we would like to see them in order to ask them some questions. So I'm sending through their webcam requests so that you'll be able to see their faces as they now, you know, answer some of the questions that you may have. Anya, nice to see you. Jason, thank you so much for your presentation, and voters coming online too. So thank you very much, everybody, for the information, a very comprehensive explanation, I think, of the tool. It's very exciting to hear that it's app-based because I think, as you said, Anya, everyone has a phone. And so to be able to control things, you know, you don't need necessarily a sophisticated process or a sophisticated set of hardware in order to do this. You have access to the information just literally from your phone. So perhaps we can ask you a couple of questions. The first one I would like to ask you is, with regards to NSF Africa, as I said, we are a little behind the curve. You know, obviously we only started with confirmed cases of the pandemic in March, whereas in other parts of the world we've had confirmed cases going back as far as, you know, November. How have you ensured that the training that's being conducted within South Africa for the South African staff is adequate? because obviously this is a very new process to everyone. As you said, Jason, this is changing on a daily basis. So what assurance can you provide me as a client that your South African team is in fact on par with the latest information worldwide, and we have sufficient technical expertise to be able to ensure that we are in fact applying the best principles, based on how quickly they're changing? Wouter, perhaps you'd like to comment on that.
Yeah, Linda, fortunately, our company is quite advanced in using technology, and so we've got very great systems to make sure that all our staff on one system, where we share a lot of information. We're using the latest technology for that, and we've got a huge amount of online training that we continuously, let our auditors go through. Obviously, this is training that we could also and do also sell to the public or make available. And with that, of course, goes hand in hand with that goes assessments of the understanding. And since we work and part of NSF is a public health and safety company, we also have a health sciences division. We are really close to the disease and to the problems, and doing a lot of research, working with universities. So that information is current and it's shared in the business all the time.
That's great, because I think, at the end of the day, I'm still looking to meet the virologists. We're hearing a lot from a wide range of different scientists, but I would like to hear from the virologists, because obviously this is a virus, and it does pose slightly different challenges that I think that we have had to deal with particularly in the food industry before. Jason, you mentioned the part about this is applicable to more than just the food industry. I mean, obviously, we're talking today on food focus, but, one of the things that I was definitely struck by is the very wide application of this tool to, as you said, dentists, schools. Anya, you mentioned museums, and I would definitely like to encourage the audience to phone a friend in that regard, because it's important, I think, that we share this outside of the food industry. It's not just for us. It's got a very, very wide scope of application. Jason, if you can maybe just give us some ideas in terms of where you've currently applied the tool within South Africa. I'm assuming it hasn't just been the food industry.
Well, in South Africa, currently, we haven't implemented it anywhere yet, as it's a new system and we are bringing it through. But we are looking at obviously approaching different organizations, and we are hoping that they will approach us as well.
Yes.
If you look at taking into consideration local requirements, the fact that we are using it in different countries, we have developed and continue to develop sort of tools and requirements. And we have all our regional teams in South Africa. Obviously, we will take into consideration our South African rules, and we'll modify it for South Africa. Globally, we're doing exactly the same thing as well. And I must be honest, though, our global toolkit that we have does already cover around about 80 to 90% of what is required. It's just that little tweaking that we need for each individual region or country or industry, for that matter.
While we're talking about that, what about local requirements? I mean, obviously the legislation is slightly different in each country. We're having long discussions about the extent of our lockdown measures in relation to, for example, America, where they're seen to be just carrying on as normal. How do you make sure that you actually ensure that it is fit for purpose within Africa? Because even within Africa, we could have a range of different legal requirements.
No, like I said, it's up to the regional team. So basically, what we do is we will have a look at we'll have a look at our regulations here. We have a look at local best practices, anything that clients might put through to us as well and request, and we will customize it for the individual customer. So we'll customize it from a schooling perspective. We'll customize it for the food industry. And again, we have got a lot of experience in the food industry, but just as well, we have got a lot of people abroad that's doing learning. And I know we have implemented it at museums abroad. We've definitely implemented it at schools abroad as well. And all those learnings then gets passed on to passed on throughout the organization. So we have got a global resource for that kind of information. Yes.
Great, and I think that's obviously definitely an advantage. One of the things that I wanted to just comment on in terms of the food industry is, obviously we've been business as usual since day one of lockdown. But I think what we're seeing as an increase is the number of closures and reopenings. Obviously, as the curve is continuing to climb, I think the food industry is being far more affected by closures and reopenings now than we were earlier in lockdown, and hence the need to ensure that your programs do actually meet the requirements. And I think from that perspective, Jason, you know, the comment with respect to the food industry is, even though you may have a plan, now may be a good time to reevaluate that plan. And this process gives you an opportunity to reevaluate your plan, even though you may have a plan.
Exactly. And I did mention, you don't exactly need to go for all 3 phases. We're not trying to sell all 3 phases as well. It's there to help an organization put systems in place to protect people as well. So if you're going to go for one phase, if you're only going to go for the app, there's nothing wrong with that. We will still assist. There's a lot of support that can be offered to you as well.
Great. Right, let's hear from the lady in the team. Anya, I want to know about this app. I mean, you're NSF Africa, so that already poses a challenge when it comes to languages. You know, we've got 11 official languages. That's already a challenge just for our country. But I mean, if we go further north, you've got countries that are, you know, speaking French, Portuguese. How are you going to manage that in other areas where you are operating as NSF?
Yes, that's a very good question, Linda. Yes, so in fact, we already built a few translations apart from English onto the app. Globally, we've already implemented the Spanish and French, Portuguese, and so on. So the app is being built on a very modern framework. So the translation is actually quite easy to put or to modify as text on a spreadsheet that can be loaded onto the application. So it would be very easy to translate, for instance, to Xhosa, Zulu, even Swahili for the East African countries. So yes, that's quite easy to translate for our other users as well.
Okay, so now I have to confess, full confession, I'm an Apple person. So I'm assuming I'm going to go to the Apple store. For those of us that are not yet at this level and you're still on Android, I'm assuming you've taken care of both platforms at least, but I'm not being paid by Apple, just as a matter of interest. What about desktop versions? You know, other operating systems. Have you, is it compatible with all operating systems, or do I have to have a particular device?
Yes, absolutely, Linda. It is available for both Android as well as Apple. So the first thing that we did was to actually develop it for both platforms. So itself is pure mobile native app. So it's for the simplest users. So it's very user friendly. And yes, it can also have be available on desktop as well.
Super. Okay, and then when it comes to, possibly a little bit more complicated questions with regards to, how is NSF ensuring that this is in fact, marketable? So Vota, for the general public, I mean, seeing a sticker on the door, I think that's, the first time I walk into a facility, that's definitely going to be important to me because, it gives me some, it gives me some confidence with respect to the organization has had some third party, verification, so to speak. But what's NSF doing to make sure that everybody knows who is NSF and the fact that this sticker means something at the end of the day?
Yeah, absolutely, Linda. You would want to inform your staff and customers that they are safe to visit your facilities and that you have put everything in place to ensure this and to show that you are confident enough to appoint an external independent company to validate this. So yes, this is used by many of our clients as a strong. But as NSF have partnered with a global PR company to promote awareness to this and what it means exactly, and help us with the outreach globally. But I want to emphasize again that that every customer and staff member entering your doors where the sticker is placed will potentially become a citizen ambassador of your efforts.
Absolutely, and I think at the end of the day, you know, by word of mouth, that kind of thing can definitely spread and obviously assist. I think one of the challenges that we do have in the pandemic is the number of organizations that have sprung up overnight to do a variety of activities that they're not necessarily competent to do. We have every man and his dog manufacturing hand sanitizer. We have every man and his other dog now offering, you know, cleaning services. And I think one of my personal concerns has been the fact that there is no governance associated with many of these activities. You know, we specifically are chatting to, you know, the National Contract Cleaning Association, because I think some of the services associated with the pandemic are very, very important and need to be done in a proper way in order to actually have that confidence in public health. And so I think, you know, from your perspective as an organization with the reputation that you have worldwide, I think that's something important to consider and also to bear in mind, you know, in terms of the process that you follow. A couple of last questions, Jason, with regards to, you know, the experience that you've had. You know, I'm sure for many people, one of the concerns that they have is children going back to school. You know, high volume areas like, you know, call centers where, you know, people can't necessarily work from home. You've got a large number of people in the same place. Has NSF actually, you know, used this program in those kinds of environments, call centers, schools, you know, high risk areas, purely because of the number of feet?
Yes, absolutely. To be honest, I think the image that we showed, the schematic we showed earlier, was for a call center as well. So yeah, we have used it for, well, internationally, we've used it in schools, universities, university hospitals. And that's the nice thing about it. At the moment, we are gathering quite a lot of information by, and like I said, we're global, so it's being used. We've got quite a lot of clients. We've got, unfortunately, won't be able to name them for confidentiality purposes, but we've got quite a lot of big organizations and big groups that has come on board with us. And again, not just in the food industry. I can say we have museums, we have got call centers also in place, the hospitals. So it's quite big, it's multinational. And like I said, we're building all this information and all this criteria for us to be able to assist each and every site, and then obviously we're using it and creating checklists, developing systems. So it's there as a helping, a stepping stone, and it's there to help companies develop it. And obviously, if you do have something that's been developed, so if a school, if you look at South Africa's case by now, there has been certain things that's been done as far as schooling is concerned. They've got certain control measures in place. So what we can come and do is we can have a look at that. We can then assess that and make sure that it is going to be effective, or to the best of the ability effective, using these criteria and using the experience that we have, and then obviously offer advice and be able to perhaps assist them in the monitoring process. So yeah, most definitely.
Yeah, because I think for, you know, one of the things that would really discourage me would be you telling me that I have to start again. You know, particularly, you know, for companies that have been operating as essential service providers during level 5 and level 4, we've had to have systems in place in order to meet those legal requirements, just to be able to continue operating. So I can fully appreciate then, you know, having an independent assessment of what I've done, but starting from scratch, I really don't think is an option, given the fact that we're already, you know, stretched very thin, and there's a lot of additional strain on organizations. So that's good news. Another question, just with regards to existing systems. I think what the pandemic has definitely showed us is the fact that perhaps our health and safety systems were not where they needed to be. because this is impacting on the health and safety of not only clients, but on our employees. And so if we didn't have proper controls in place for the health and safety of our employees, this pandemic has definitely highlighted, that fact that we have areas that we need to improve. How does this system integrate with existing health and safety systems? You mentioned it's important for a company to have a quality management system, or that it's easier for a company if they have a quality management system in place. But what about integration with health and safety? Because, the pandemic is one thing, but we as a country have serious issues with TB, for example, and it's not that it's just about COVID-19. We have to consider the health and safety of our employees on a day-to-day basis. So how does this system support or integrate with my existing health and safety system?
Well, it's perfectly okay to use the existing system that you have. So basically, you would have a system in place. We would then come and assess and see how we could then, I won't say improve, but amend your system to take all the COVID requirements that you have in place. I actually sat on the National Institute for Health and Safety on the meeting about a week or two ago, and they have looked at the COVID. Well, they've put a COVID response in place. They've actually got I know it's a free data-free website that you can go. So it's something that employees can go to as well and have a look. And what NSF can do with the NSF check by NSF is that we can put in checklists for health and safety as well. So when we talk about QMS systems, it's not just the quality management system, but any management system, including health and safety. And that is something that we definitely will look at. And that comes down to social distancing at the facility. That comes down to, again, putting things like identifying all your high-risk individuals and making sure that the areas that they work in is better controlled, that they maybe have a separate office, that they work in a lower risk area, that they don't work with a lot of younger or more, that you maybe put your high-risk individuals in a certain area, looking at the changing area, if you're looking at a food facility, for example, and all of those type of things. So it's definitely part and parcel of what we can offer.
Absolutely. Thank you, Jason. A last question for Wouter as we finish off today's presentation. Wouter, I noticed that, Jason had mentioned that this is a 12-week implementation process if we start at phase 1 and move all the way through to phase 3. I think that's important to note, because this is not a quick fix kind of situation. It's not like you're going to just walk in tomorrow and everything is going to be hunky-dory and you've got a sticker on your door.
Yeah, no, absolutely. I think, and as we also said, it does vary a lot, from customer to customer. So it really, if you have a lot in place already, we will probably only come in and validate that, which is a desktop exercise. We would review documentation in your procedures, and then if you want us in to also come in and say, all right, let's come as a third party and validate that you have put it in place. That would take a little bit more time, and once again, it depends on the complexity and the geographies of your organization. As Jason mentioned, one of the cases we had where systems and processes are very well entrenched in a company, we only needed to take a square root sample of their sites and visit them. So then it still takes a lot of time, because it's a lot of work to review, to implement, and to make sure that these practices are entrenched. So yes, I think it's not an understatement to say that this could be 8 to 12 weeks.
And then there's a question that's come from Annika. Would like to know, what about the involvement of the Department of Health? So, I mean, at the moment within South Africa, we have a lot of inconsistency in closure and reopening in terms of who gets involved, who doesn't get involved. I mean, the law obviously places the responsibility for the steps that need to be taken on the person who is in fact the owner or the employer of the facility, and that's always been the requirement. Your 16.1 has always been the person who's in charge of the facility, whether it's the CEO or the managing director. Obviously, there is additional requirements in terms of COVID to establish a COVID a champion or someone who takes responsibility for this particular program. But in some cases, companies have closed voluntarily and then they've opened after they've taken the appropriate, steps. In other cases, the Department of Employment and Labour has closed facilities and then they have to reopen those facilities or sign off on the reopening. In other cases, we've had the Department of Health through the EHP involved with the closure and reopening of a facility. So there has not been consistency and there is not a particular legal requirement that has been defined as part of the disaster regulations. So that aside, what input involvement has there been with regards to, local government authorities on the system? Have you had any interaction with, the Department of Health, for example, in the Western Cape, to understand the system and to give any input or any feedback?
Well, and I think, there's a huge opportunity in that. We haven't had contact with those departments yet, but as Jason mentioned, for instance, Department of Education or Department of Health or an industry body might decide that they want to use this system and become the specifier in their sector that this should be the way to do, so that they can then demonstrate, for instance, to the government or those that bring in the restrictions, that we've got an independent body, we've got very good principles, processes, and things are in place, which would be a very strong motivation to throw back, to say, this is what we're doing, it is in place, and it's vetted by international independent body, and thereby hopefully could motivate the reopening.
Yes, absolutely. And as I said, there is currently no legal requirement which requires a sign-off, so to speak, from any particular government body, unless that government body has actually, issued an instruction to be closed. But I agree. I think, from the perspective of being able to demonstrate good governance and to be able to demonstrate due diligence, obviously an organization such as NSF could definitely assist in providing those levels of confidence, as you've already mentioned. Last question, Bota, are you using your own system in your offices?
So, well, all of us have downloaded the app, which is really only launched last week, and so we want to use it to test ourselves. And what's nice about it, all the policies and procedures that you would like to see, you can load on there. You can set it up to give you reminders of checks. So and all the checks that you do, then you can load any checklist on there. So absolutely, we're already using a lot of apps in our auditing world. So clearly we are implementing all these things in our offices, but yeah, love to use the app now as well.
Great, because I mean, these requirements are for any organizations that could benefit from this kind of system and that may be looking for help. Please make sure that you pass on this information, because it's absolutely critical for all of us as citizens of South Africa, that wherever we go, we're doing the best that we can to contain the pandemic and to ensure that we actually conquer COVID. Have a great Wednesday, and we look forward to chatting to you soon. Thanks so much for being with us today.